We are now hearing from state health leaders as they open up the vaccine appointment site for all adults to get their COVID vaccine booster. The FDA and CDC signed off on extending boosters for the Pfizer and Moderna vaccine to all Americans 18 and older. And this morning, our Lauren Kostick tells us what you need to know.
The approval of the booster shot for all adults comes as several states across the country are seeing an uptick in COVID cases, including Indiana. Right now, more than 3,900 Hoosiers have recently tested positive. That's a 64% increase in the last 2 weeks. And the positivity rate is above 9%, nearly double the state's goal of 5%.
Moderna first,
And this is a trend Hoosiers saw last year before the holidays. But this time, some of the cases are breakthrough infections as protection from the first round of vaccines starts to wane.
Vaccines are designed not only to prevent infection, which they do, but they're also designed, perhaps more importantly, to prevent bad outcomes from happening.
And the third shot can help boost some of that immunity. On Friday, the CDC's director signed off on approval for both Pfizer and Moderna boosters for everyone 18 and older. This means anyone who received their 2 initial shots 6 months ago will now be eligible. Johnson & Johnson's booster is already available to anyone 2 months after their initial dose. And officials say you can mix and match. Health experts say it's key as we enter into the winter months.
We're up to about 20% of the vaccinated population now has a booster, which is great. And I hope that those trends continue.
Another big question now that booster shots are widely available, what does it mean to be fully vaccinated? The CDC said it's still not counting booster shots, but some health leaders say people must have a booster shot in order to be considered fully protected.
And this is important to note. Next week is the deadline for families wanting their kids fully vaccinated by Christmas. Pfizer started giving shots for kids 5 through 11 the first week of November. So if your child got their first dose then, the next dose should be available next week. And remember, it does take 2 weeks after the second dose to be considered fully vaccinated.